I remember that child. That child actually came around 6 o'clock in the evening. This child was very dusky. The blood saturation, the oxygen saturation was only 64 or 65%. And the child was in a comatose stage with impending respiratory failure, severe hemodynamic instability. I was actually looking at the child. The first thing on my mind is, my God, this child is so sick. Can we actually really save this child? But the father was so insistent that we do everything for this child. And I still remember very, very vividly, because I intubated this child, and I can remember the moment I put the tube in, there was a pink gush of fluid. That's the severe pulmonary edema. The severe fluid, that hemorrhagic fluid which is inside the lungs, just gushed out onto my face. And we had a huge trouble trying to ventilate this child, because this child had severe pulmonary edema, ARDS, had cardiac dysfunction, had renal failure, liver cell dysfunction, you name it. Every complication in the textbook of pediatrics this child has had. And 12 years ago this happened, and this child was on the ventilator for almost 6 days, and with great difficulty we were able to get this child off the vent. Needed multiple transfusions of FFP as well as platelets, fluid management, inotropes, and it was a whole team effort at Little Stars Children's Hospital. So within 2 weeks, the child is off to home. Now the child is going to college and doing well. That's very, very heartening, very, very heartening.